So I'll start with the question the other way around, really, that a headache is actually a symptom, and it can be due to many different things. And migraine is just one of those, one type of syndrome that actually causes a headache. It's like saying, I've got a pain in my ankle. I mean, that can be due to arthritis. You could have just twisted it. You could have broken it. So headache is a very broad spectrum of conditions and causes. Migraine, however, is a primary headache syndrome, and it is one of a number, but it's the one that's most commonly found in the population and the one that most people know about, and usually is divided into sort of sections with certain symptoms. Can be very mild and can be very severe. There's a big spectrum of how bad it can be, but there's usually some sort of prodrome where somebody feels not quite right or might have some food cravings. Then there may be an aura. Not everybody suffers from an aura, which is usually visual. They may get zigzag lines in their visual field or lose part of the visual field. And then it will go on to a throbbing, usually one-sided headache that may be associated with a number of different symptoms, such as nausea, vomiting, not being able to tolerate light, which is called photophobia, not being able to tolerate sound, which is called phonophobia. And a lot of people will end up having to actually go and lie down in a darkened room until they get over it. Majority of the time, that is not a serious condition at all. It is a very, as I say, a very specific headache syndrome that is a completely benign syndrome. But it can cause a lot of disability for a short period of time while you're suffering the symptoms. And that's the biggest problem, is that the interruption to daily activity. If it's very severe, you might have to stop it completely. But even if people are getting very mild migraines, it's very difficult to concentrate or to read or just to carry on with work or children and house. So it can cause a lot of day-to-day issues, but it is not a serious condition. Well, thankfully, most GPs these days are very knowledgeable about migraine treatment, and they know about the difference between migraine and headache syndromes that might require more input. So I would always say, first of all, go to your GP, because they can help with the initial acute management and maybe even start on some of the prophylactic medication. But if it becomes difficult to manage, or there are other symptoms, then that's when a GP will often refer you on to a neurologist, or someone might come to see a neurologist. It's always helpful if you have information ahead of time. I mean, to know that you're going to get asked about the headache. So it's a good idea to have some idea of how often you get them. And it's very difficult to really remember, even last week, how many headaches you might or might not have had. So if you are going to see a neurologist, it's worth keeping a headache diary, looking particularly at how often you're having them, how long they're lasting, and the severity. I mean, you can put it on a scale of 1 to 10, or 0 to 10, 0 no headache, and 10 being the worst possible headache, to give the neurologist an idea of what, how often and the intensity. Also, what's very important is to know what medication you're taking now, but also what medication you've had in the past and what doses you've been on and how long you've been on, to really see if you've done proper treatment trials. So all of that information will be very helpful. Also family history, if there are other people in the family that have it, and if there are any other symptoms and any other medical conditions that you have. Well, for a start, it's very important, firstly, to take the history and make sure it is actually, or you're actually dealing with a migraine. Many people can be misdiagnosed if there are sort of unusual symptoms that may or may not happen at times. So firstly, to make a full diagnosis. Secondly, to help particularly with, now, it sounds very funny, but sometimes taking away some of the medications that you're taking, because very often with migraines, there is a syndrome of analgesic overuse. And analgesics are painkillers. So the standard painkillers that everybody uses, paracetamol, ibuprofen, codeine-based medication. But sometimes using these can actually make the headaches worse. So it's important to make sure that you're not taking too much of the standard medication. But then what we can do is help with the acute treatment. So actually dealing with each acute, every time you have a migraine, if it's not happening too frequently, to help with the actual management of that headache to make it go away quicker and to not come back. But if that's not possible and there are headaches happening very frequently, then we will start a range of different preventative medications that we have at our disposal, and we'll work our way through to try and find the right one for the right patient. And now that field has grown incredibly. So not only have we got some of these oral medications, but there are a number of injectable treatments that you may have heard about, botulinum toxin, greater occipital nerve blocks, and now the CGRP peptide receptor drugs that basically are injectable forms of preventative medication. So we have all these possibilities at our disposal, and we can help to try and improve your life and to improve the number of headaches and the intensity.